Hello, my name is Sivan Cook, and today I will be presenting my assignment for Marriage and Family Therapy 6102 on evaluating the character to develop a treatment plan. For this assignment, we will be focusing on reviewing, understanding, and applying the diagnostic information on psychotic disorders and schizophrenia found in the DSM-5. We are to pick a character from one of three movies uh, and provide a diagnosis and treatment plan for addressing that character using a family therapy approach. So I would like to first of all apologize in advance for the looking down as I am referring to my notes. My choice of character and movie was June. June is the character from the movie June and Benny, or Benny and June, I'm sorry. Uh, June is a Caucasian white female, probably in her early 20s, and died with a general diagnosis of mental illness. A brief overview of some of June's symptoms includes um sudden emotional outbursts that lead to violence, including throwing things, disorganized thinking, auditory hallucinations, and delusions. Most of these symptoms occur at the onset of stress or agitation for June. She is very high functioning outside of the symptoms. She functions fairly well, and this could be because of her already established psychotropic medication routine and her psychotherapist, which was visible in the film, that she's on a medication and she, from time to time, sees a psychotherapist. So we're going to take into account the symptoms that I've just brought up. We're going to go now through the diagnostic criteria of schizophrenia. Oh, I'm sorry. I am deciding, taking into account the symptoms. I am diagnosing Juniper with schizophrenia with multiple episodes in partial remission without catatonia. So now let's review the diagnostic criteria for schizophrenia. Criteria A states that one or more of the following symptoms must be present and significant for a 1 month period unless it's successfully treated. So at least one or more of these following symptoms should be present for at least a month or during a month period. And those symptoms are either delusion, hallucinations, or disorganized speech. June, as I already stated before with the brief synopsis of her symptoms, does display or has displayed delusions and hallucinations, as well as disorganized speech, which is also the same as disorganized thinking, because disorganized thinking is made manifest through the speech and how they're speaking or what they're talking about. She also displays, and is not listed as being one of the ones that should be present during the month. She's also displaying disorganized behavior, which is apparent through her childlike behavior and her unpredictable agitations, which in June's case, within the film, for example, would be her unpredictable agitation in the film looks more like a tantrum, that she's throwing tantrums, and that in a way is childlike. When she doesn't get her way, or when a marked agitation or stress is is present, June gets emotional, gets violent, have outbursts, and all of this is indicative of disorganized behavior. Criteria B states that a significant portion of time since the onset of the disturbance for a significant portion of time since the onset of the disturbance, level of functioning of one or more areas has had to have decreased in levels in areas such as work or self-care, interpersonal relationships. Um, One or more of those areas levels has had to have lowered since the onset of the disturbance. Unfortunately, um, within the film, they did not really allow us to see what Juniper's behavior on behavior functioning was prior to the onset of the disturbances. However, when you see the her current level of functioning, specifically interactions with others, especially when she's agitated and stressed, it's kind of safe to assume that possibly prior to the onset of disturbances, maybe her level of interactions with others was higher than what it is now, unless her onset was at adolescent or childhood stage. But as I stated, we do not get to fully see what her prior state of functioning was prior to the disturbances. Um, we also can assume that they're lower because now June is not allowed to leave the home. They leave the home by herself or go places alone because everyday triggers or everyday functioning in the outside world would trigger a stimulus for her that would be stressful, which makes it difficult for her to do work. As far as her self-care, um, pretty much June's outer appearance is appropriate for the day or for what she is doing. But once again, I have to take into account that she has a caregiver in her brother Benny, as well as in those who Benny hires to help him with her. So therefore, her self care, she has someone there to redirect her or to remind her if needed about her self care and appearance. So we do have to take into account those things as well. Criteria C states that continuous signs of disturbances must persist for at least 6 months, and during this 6 month period, there must be at least 1 month of symptoms, or unless it's being successfully treated. That meets criteria A. So the signs must persist for 6 months, and one out of those 6 months, there must be an episodic uh, display of symptoms like hallucinations or delusions. Um, and when we when I look at support within the film, signs of a disturbance for Juniper, this illness and this disorder has persisted for over 12 years, and they make that apparent in the film as the brother is talking to the psychotherapist. We find out that Juniper um, has been dealing with these symptoms and this disorder for over 12 years. Um, But however, the frequency of episodes are not as consistent. And I would like to state that this is probably due, once again, due to her current psychotropic medication routine, and also the fact that from time to time she sees a psychotherapist. So currently, within the film, Juniper has a already established med routine, and as I stated, a psychotherapist. So therefore, this may have a lot to do with why her symptoms are maybe not every day or not as frequent, and only contained to stressful or agitated stimulus. So we have to take into account that the level of frequency occurring within the month and not being as frequent has to do with those things. Criteria D talks about ruling out other disorders, and it says that schizoaffective disorder and depressive or bipolar disorder with psychotic features has to be ruled out. And in this case, it is ruled out because there is no depressive or manic episode. So June does not display any manic or major depressive symptoms. Criteria E states that the disturbances also cannot attribute to any other physiological effect or substance, chemical abuse, or any other medical condition. And once again, this is true of Juniper. There are no other physiological things going on with Juniper, no medical condition, and there is no substance abuse or chemical alcoholism or any type of abuse of that matter associated with Juniper's disorder or with Juniper's symptoms. And last but finally, criteria 4 also states no history of autism, and as it relates to Juniper, this is true. There is no history of autism for June. As far as specifiers, there are no symptoms of catatonia, which is decrease in reactivity to environment or excessive motor activity without obvious cause. None of these symptoms are apparent with June, so that is why it is schizophrenia without catatonia. She's not displaying symptoms of catatonia. Also, it is multiple episodes currently in acute, I said in partial remission, because she is taking her meds and being appropriate with her meds. It's not the word I'm trying to look for, but she's being correct in taking her meds, and so therefore we're in a process of not having as many episodic episodes in regards to the schizophrenia. Now I would like to go into description of disorder. So, description of disorder, according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, schizophrenia has a range of cognitive, behavioral, and emotional dysfunctions, but no one single symptom is characteristic or indicative to the disease. Diagnoses involve a recognition of a group of symptoms associated with impaired occupational or social functioning. What can be difficult is the fact that the individual will vary substantially on most features, as schizophrenia is a heterogeneous clinical syndrome. The variety of features required even myself, even me, to do additional rule out checks for other disorders. So, as I was stating here, because the features and the symptoms to look for are so varied, and each person does not manifest uh, schizophrenia or display schizophrenia the same. It's sometimes hard or can be difficult to diagnose. I initially actually diagnosed Juniper with something other than schizophrenia, and I had to go back because her symptoms were varied, but these are also symptoms of other disorders. And the thing that basically um, pretty much tied into this being schizophrenia was the duration of the disturbance itself, how long she has had the actual problem, or how long the problem has persisted. That is really what made the difference between it being schizophrenia and something else. But it's can be difficult because everyone's schizophrenia does not look the same. So the fact that schizophrenia is a debilitating disorder causes researchers to continue to look for causes and reasons, or causes for the disease, or what factors are involved in getting or developing the disease. Early researchers did not give explicit theories on the etiology of schizophrenia, but did suggest biological components. One of the most well-established findings in research is that the illness can be inherited. The risk for schizophrenia is elevated if you have a relative with the disease. The vulnerability is the vulnerability is genetic in nature and derives from several genes acting in concert, or numerous single susceptible genes acting independently. So another theory also associated with cause of schizophrenia is environmental causes. So when researchers talk about environmental causes, they're not talking about where you, like, environment as in like inside of your home. When researchers are talking environmental causes related to schizophrenia, they're talking about anything else other than genetics. So researchers are looking at any factors that can influence the development of schizophrenia, and some of the noted, some of the noted factors that researchers have found include level of stress during childhood, drug use, specifically marijuana, city living or city urban living, if you've had previous child abuse, the factor of early child abuse or being susceptible to child abuse, exposure to X-ray or radiation during early childhood, and head injuries. So these are just some notable factors that could cause or be a causation of schizophrenia. The onset of the clinical symptoms of uh, schizophrenia, according to Walker and others, can be abrupt or gradual, but is preceded by escalating signs of behavioral dysfunction and subclinical psychotic symptoms. Following the clinical onset, patients vary significantly in their illness course. Some patients experience a full recovery, Others show chronic debilitation. Information noted by Walker and others in the 2004 article on schizophrenia states that 20 to 30% of schizophrenic patients are able to lead a relatively normal life, meaning that they can live independently and or maintain a job. However, this means that the other 70% have a debilitating course and are dependent upon some type of support either from outside agencies or from their families themselves. We learned in previous readings that one of the effects that this disorder has is not only on the individual, but also on family as well. As stated in Christensen and others' study on family intervention and schizophrenia, family members are usually the primary caregivers and act as intermediaries between the patients and service providers. And this is true of Benny in Benny and June in the movie. The study goes on to state that how the study goes on to state how families provide important support during recovery, encouraging treatment adherence, and ensuring that the patient receives the services that they are most needed. This is true, as I stated, of the family within the film. Juniper's brother, Benjamin, was basically the main caregiver. He made sure that she ate, she took her medicines, had appropriate services as needed. However, where things may have been doable for Benjamin, um, and where things that may have been doable for Benjamin in the past, I believe now some of the things are becoming stressful for even Benjamin to handle on his own. So, in the study, Christensen and others also notes that the most common type of intervention in schizophrenia literature is family psychotherapy. Among the educational topics frequently covered are coping skills, stress management, problem solving, and communication skills for lowering expressed emotions that are manifested as criticisms, hostility, and emotional over-involvement. So in the study in Christensen's study, they actually talk about expressed emotions, which is kind of a typical thing within families where we kind of talk to, we're kind of critical or more critical with each other because we're family. And this, can cause hostility and even lead to emotional over involvement, which, as I believe within the film, is what is occurring or happening with Benny as it relates to June. I believe now he's at a point where his involvement is just over. It's just over and beyond. And I just think that is why it's necessary for something to be done that would alleviate, because I believe that Benny is like a stressful stimuli for Juniper. But in order for us to even see that Juniper, that Ben is a stressor for Juniper, you have to see the relationship that is between Sam and Juniper. Okay. So now I'm going to talk about treatment plans or treatment plan, my treatment plan. So while I was attempting to find the right model for the treatment plan, I began thinking about what would be best for all involved. The overall goal honestly, is for Juniper to have less violent emotional outbursts. From the film, it is noted that this happens whenever she's agitated or mad or stressed. So two examples of this is when she wanted the housekeeper to leave. She was tired of dealing with the housekeepers, and she didn't want the housekeeper there. And so the housekeeper wouldn't leave, and she got upset or agitated, picked up something and threw it at the housekeeper. Another example of where June emotional outbursts happen at a time of stress is when her and Ben were playing ping pong, and Ben gave the score, and Juniper did not agree with the score that he gave and stated that, "Oh, you're trying to cheat me." And Ben's like, "No, I'm not trying to cheat you." And Juniper was like, "I know how to count. You're cheating me." And the transaction went back and forth between Ben and Juniper, she became agitated and threw the ping pong paddle at Ben and hitting the lamp. So there are times where, I mean, it could have gotten um, she could have hurt both the housekeeper, and she could have hurt Ben in the process of her agitated outburst. So this is why the goal is to decrease these episodes of these emotional outbursts. However, when Sam comes on the scene, it seems that Sam has a different effect upon June's mood. And when Sam was around, there weren't any outbursts noticed with Sam, except for the last one where and it wasn't Sam that initiated the stress that caused the last episode to occur. But Sam just happened to be with June while she was having the meltdown. But that was initiated through something that occurred between her and her brother. So there was even a time in the house where Sam, who has basically been asked to stay, or we have been asked to stay with Benny and June by his cousin, who didn't want him with them. There was a time where he was in the house, Sam was in the house cleaning, and he was playing music, and the music was very loud. And June, she reacted to the loudness, and you would think, when you're looking at it, you would think this would be a stressful time or a moment of agitation for June, but instead she yelled and told him to turn the music off. He turned the music off. She grabbed the radio and she took it away. Now, once that happened, we later find out that after that happened, Sam left the house. So, and June was left. He left the house and basically went across the street. He didn't leave the area of the home. He just left out of the house and went across the street and sat. And I believe that this gave Juniper the opportunity to basically sit and think about what occurred in a correct manner without there being a stimulus in the room, a stressful stimulus in the room with her, because Sam had left the environment. So now it's just Juniper and herself. And I believe that it allowed her to think out what happened, because when Ben returned home, she's like, "I don't know what happened. He left. I didn't mean to make him leave." So I think that time to herself, she was able to give thought as to what really occurred, and that was it was a positive. It was a positive. So therefore, taking into account that um, also there was a time within the movie where June alludes to the fact of being treated like a mentally ill person. And when she did this, it was not in a positive way. She alluded that people, you're thinking, you think I'm mentally ill, so you think I don't know nothing. You think that I'm mentally ill, and so I allow people are taking advantage of me. These are the things that she was alluding to. So her thought process of being mentally ill and even being treated as such is not a positive thing, and it's not what she wants. And, another is that there seems to always be apprehension with Benjamin when it comes to Juniper. However, that same apprehension does not exist when Sam's in the room, nor does it exist with interactions between Juniper and Benjamin's friends. So I had to take all of this into account. And taking all of this into account, I therefore believe that uh, the collaborative therapy that I would use, the model collaborative therapy, and I believe it's a good fit for Juniper and her brother. I believe that it is also a safe vehicle to be able to introduce some psychoeducation in regards to Juniper to Sam, and to give Sam some information on how to deal with Juniper and her episode. So the reason I chose collaborative therapy for this family is because it's important for both Juniper and Benjamin to gain their own sense of autonomy. It is important for June to feel a sense of agency in her life, um, and a sense that she is competent and able to make meaningful actions and make meaningful decisions. This level of agency will assist in decreasing her stress levels. As she stated in the film, she's just tired of everyone telling her what to do. So giving her own sense of agency, and giving her an opportunity of feeling competent about making her own choices and making her own decisions without somebody else's input, I think will help her agitation and stress levels come down to where she can function better, um, overall. So further, the collaboration process of interaction allows for transformative thinking. In therapy, the client's narrative of self-identity, who they tell themselves they are, is transformed through the dialogue. I'm tongue-tied right at the moment. The dialogical process. So, and this, I think, the dialogue exchange is necessary for Benjamin as well, so that he can see that he's not just a caregiver. And I think that in this collaborative environment, the both of them can begin to look at their roles with one another in a different way, and not just I'm the caregiver, you're the person, and I'm trying to make sure that nothing, that you don't go off the wall. I'm also your brother. So my structure treatment plan, of course, initially would be to develop a collaborative partnership with each member of the system, which would be June and Benjamin. And then I think Sam will come in later on. Use regular language so that everyone feels comfortable and safe. I identify the problem and who's talking about the problem, and give them their description of the problem, and whether we're all on the same page. Um, Listen to how each person interprets the situation. Also, collaboratively identify goals that each person agrees upon. Hopefully, one of those goals would be working to decrease Juniper's stress and agitation, as well as working to decrease Benjamin's stress as well. And finally, identifying needed referrals and collateral contact and other client needs. So specifically for June, we also want to continue with her daily drug routine, and making sure that she's being compliant with seeing, or taking the medicine, and making sure that all is well on on a psychotropic aspect of her treatment, because within the film it is obvious that in some way that the psychotropic medication is aiding her in keeping the major episodes of delusion and hallucination down to very minimal. And we want to continue in that vein. So this would complete uh, my evaluation of Juniper, and which is the character from Benny and June, the movie Benny and June. And I hope that you have enjoyed this evaluation. Thank you.